So, how do you even begin to fight diseases that affect over 1 billion people, yet most of us have never even heard of them? Well, today we're going to dive into some of the groundbreaking research from Unlimit Health to really understand the science and the strategy behind tackling these massive global health challenges. Let's get right into it.
And that right there, that's the central question. Because as we're about to see from Unlimit Health's research, the answer isn't just about handing out medicine. Oh no, it's so much more complicated. It's about untangling this massive, complex web of biology, our environment, and of course, human behavior.
Okay, so first things first, you gotta know your enemy, right? And we're not talking about one single virus or bacteria here. No, it's a whole group of diseases that kind of thrive in the shadows. They're called neglected tropical diseases, or NTDs for short. And there's a really simple reason they're often called the diseases of poverty. It's because they flourish where resources are the most scarce. That single idea, that's the key to understanding everything else we're going to talk about. And this is where the work from Unlimit Health gets really interesting. Their research makes it crystal clear that you can't just, throw pills at the problem and hope it goes away. The real work, the hard work, is in untangling this incredibly complex web. It's biology, it's human behavior, it's the environment, it's social systems, so you need a strategy that's just as complex as the problem itself.
So, what does that actually look like on the ground? Well, let's zoom in and take a look at one of the big ones they focus on, schistosomiasis.
And what's just incredible here is how they're attacking this thing from all sides. I mean, Unlimit Health isn't just studying the parasite itself. They're looking at everything, redefining what elimination even means, digging into why people behave the way they do, making drug delivery better. They're even analyzing 100 years of historical data. It's this full 360-degree view that really makes their approach so effective.
But, as deep as they go on just one disease, it all points to something bigger. Tackling these things one by one, well, it's super important, but it's not enough to actually win the war. So something had to change. The whole strategy needed to evolve. And that evolution in thinking is what leads us to a much, much broader, more integrated way of looking at public health.
This slide really nails the shift in thinking. For a long time, the global health community was kind of playing whack-a-mole, right? Fighting one disease over here, then another pops up over there. The new strategy is way more holistic. It's about cutting across all these different sectors to get at the root causes, not just treating the symptoms. And a huge piece of this new strategy is something called One Health. It's a simple but really profound idea. The recognition that the health of people, animals, and our environment are all tangled up together. You just can't fix one piece of that puzzle without thinking about the others, especially when you're talking about diseases that jump between species or need a certain environment to spread. Okay, another absolutely critical piece of this puzzle is something called WASH. It's an acronym for water, sanitation, and hygiene. Now, I know it sounds really basic, but the research shows again and again that without these fundamental things in place, you can forget about long-term prevention. It's just not gonna happen. I mean, think about it. You can treat someone, but if they go right back to an environment with contaminated water, that whole nasty cycle of infection just kicks off all over again.
All right, so we've got the deep dive science, we've got these bigger, holistic systems. But all the research points to one more absolutely vital ingredient: the people, the human element.
I just love this phrase. It's from one of their publication titles, Business Not As Usual. It's perfect, right? It's this signal that the old ways of doing things, the top-down approaches, they just aren't going to cut it anymore. If you really want to make progress, you need fresh ideas and collaboration that puts people and communities right at the center of it. And this is what business not as usual actually looks like when you put it into practice. It means getting rid of those silos, so the health folks are talking to the education folks and the water experts. It means bringing in social science to really get a handle on human behavior. And maybe most importantly, it means being obsessed with equity and inclusion, making absolutely sure that the most vulnerable people aren't forgotten or left behind.
So when you start to put all these pieces together, you've got the hard science, the big picture systems, and this intense focus on people, you start to get a really clear picture of what this ongoing mission is all about. There's this fantastic analogy from a 2022 publication that just sums it all up perfectly. It says that eliminating these diseases is like a relay race. It's not a solo sprint by one person or one group. It's a team effort where every single runner, whether that's a piece of research, a health program, or a whole community, has to pass the baton successfully to the next person in line.
So if there's one thing to really take away from all this, it's these 4 legs of the relay race. The research from Unlimit Health shows us you need all of them. You need that deep, specific science. You need those integrated One Health systems. You need the basic foundational principles of WASH. And, tying it all together, you need collaboration that is completely centered on people. You take one of those away, and the whole thing slows down.
What's great is that this research gives us a roadmap. It gives us a strategy. But it also leaves us with a really important question to think about. With the baton firmly in hand right now, what does that next leg of the race actually look like? And, maybe more importantly, who needs to be getting ready to take that handoff?